And a good Tuesday morning to you, 100.9 FM, 13 WMVO and WMVO.com. Sam Knox County program presented by Homes Rental and Sales. Thanks for joining us here on this Tuesday. Well, the last couple of months that Swetlic Chiropractic and Rehabilitation has been in here, I have not been in here. I was at Salvation Army kickoff and then was out for vacation day last time. So glad to be back in here to talk about some things here with Dr. Jim Swetlic, Swetlic Chiropractic and Rehabilitation here on this Tuesday. And I always remind myself to fix my posture when you're in here and try to make sure that I'm in good shape. You know, I will say, I know you've talked about it before, in that, you know, way you're supposed to sleep with a pillow between your legs and everything like that. My son, I let him, he's just a little guy, and he likes to sleep in the bed. I'm fine, sleep in the bed. But he goes, lay the way I'm laying, and I lay there, and I get up, and my back hurts every single morning. Not just smiling. So, we talk a little bit about, before we get into things like that, let's talk a little bit about Swetlic Chiropractic and Rehabilitation. You've been over at your great facility just down the road here, stone's throw away, I like to say, and great facility there. Tell us how long you've been there, a little bit about Swetlic Chiropractic and Rehabilitation.
Well, yeah, we're located on the corner of Upper Gilchrist and Yager Road at the four-way stop, just a block from WMVO. Been there since I believe 2015. Originally opened my first office in 1986 on the corner of Chestnut and Coshocton, and then moved 3 or 4 times, different office buildings. But this is probably going to be my final resting place out here. So it's worked out really nice. It's very convenient, and we have several chiropractors and then physical therapists, and we're still recruiting new members. But boy, it's interesting. It's hard to find people that are to come to work.
Yeah,
so,
that's good. You got that right. Yeah.
So we used to be 4 different chiros, and now we're just down to 2 because of the COVID. But things are rolling along pretty good. So we're still in business and hopefully changing some lives.
Yeah. As we talked about before, you've got the chiropractic side. So if your back's been bothering you or something like that, you need some realignment or different things like that, you've got that. You got the physical therapy side as well. You can combine those two. You could even, if you get a referral just for the chiropractic side, there's a lot of different options people have.
Yeah, correct. Yeah, because Dr. Overholt's the chiropractor. He's worked with me for 13, 14 years, so he's really seasoned chiro. And then we have Dr. Jim Jenkins, who's a physical therapist, and then he's got some PhDs in exercise physiology and different things. So he's been a warm blessing to our office. He's been with me for the last 2 years. Used to teach at Ohio State University, and then he was actually, we talked a couple. I think you've had him in there a few times. Yeah. He was official for the Big Ten and for the SEC,
which is great.
He used to tell me a few stories about him and Bobby Knight when he used to officiate some Indiana games. But anyways, he's just a wealth of knowledge. So we're really very blessed to have him on my team. And so as Tyler was talking, a lot of people come in for both chiropractic and physical therapy, but some just come in strictly physical therapy, strictly chiropractic. So we just kind of try to see what would be the best for that patient with that particular type of problem that they're presenting themselves with to our office.
Yeah. When it comes to treatment of somebody, obviously we always say it's case by case. You don't really know, but sometimes it can be just a one-time fix. Hey, realign what's broken, and then what's misaligned, and then other times it takes certain treatments because you almost have to train your muscles and train your body. So it's certainly a lot of different cases that you deal with.
That's correct, and we never know until we see the person. But we've seemed to draw in a lot of old chronic cases that. I've tried a lot of different other things and done well with other type of treatments, but then for the last ditch effort before maybe they're going to have some surgery or something, they'll come in and see us, and so some of those take a lot longer. And then we try to incorporate them both with the chiropractic and the physical therapy, and then discuss some home type of exercise, and which is extremely important because I always make the joke with my dentist, Dr. Martin. I said, if I come in here and get my teeth cleaned, I don't have to brush them or floss them for 6 months, right? So it's kind of like when you go in, it's kind of like just going into to us, you need to continuously be doing your home exercises and working on your posture and trying to strengthen your core and those type of things. So you got to help us help you.
Yeah. I always think about the posture thing because, quite frankly, I'm not great at it.
Well, you're better than I've seen you for a while.
The thing is, you haven't seen me for a while. So that's the only reason you think that. No,
Good point. Good point.
But the posture, we talk about kind of training your muscles and different things like that. It's the same thing. It's repetition.
Yep.
And it's really hard to have a good posture for me. I don't know. I get to leaning over, and it's difficult. I think a lot of people have the same problem, though.
And it is, I mean, everything anatomically, when we stand up, our ear should be lined up with our shoulder, and our ear and our shoulder should be lined up with our hip. But majority of everything we do, whether we're bending over to feed our face or working on our computer or texting, we're slouching forward and bending forward several degrees with our neck and our mid-back, and it just puts a tremendous amount of strain on those muscles and ligaments are trying to hold your spine in place. So after a period of time, it's just like a pair of pants with a piece of elastic. If you stretch it long enough and keep stretching, it's going to start fraying and weakening. And then one day you pull up your pants and that last piece breaks, and you're like, I don't know what happened, but my pants aren't staying up. But it's kind of what happens in your spine. I bend over to put my shoes on every day or pick up the newspaper, and I do that every day. And when I did today, I can't straighten back up. Well, it's accumulating trauma to those small little ligaments and tendons and muscles in your back that finally just say, hey, I've had enough, and they get sprained or strained or start tearing a little bit, and then there's your problem. So.
Yeah. Of course, we talk about too that a lot of people, the biggest thing that you probably see is the lower back issues, and I know you're seeing more of the neck issues too because of texting and things. But lower back issues. I mean, I don't know. I've almost come to the fact that I just am going to have back pain my whole life, and I don't know. I guess. And my posture and all different things haven't helped. But what are some of the keys to maybe avoiding having lower back pain as you go throughout your life? I'm at the tender age of 30 now, Dr. Swetlic.
Yeah.
So,
well, I mean, I started that with about an injury when I was playing college football. So that was the beginning of my couple herniated disc at that point in time. So I realized at that point in time the key to maintaining my spine was probably being on a good core program and keeping my weight down and exercise and obviously I'm in a good position because I have other people that work for me that are chiropractors and physical therapists. So I'm on a pretty good routine getting adjusted, regulated, and we have different tables called Spinal Decompression that I use quite a bit, and because it's pretty physical work that we do in my profession. We're always bending over people, doing different things, and then I'm not real nice with my body around my farm at home. I'm always cutting trees down or doing something of that nature. So, and then yesterday all the snow shoveling.
Yeah.
So it's just an ongoing process. So what do? You just maintain it the best you can. I think diet, exercise, and a good keep your stress level down too.
Yeah. You mentioned about shoveling snow and everything. Hopefully, it's the last time we have to do this all year.
Amen.
But it's January the 18th, though, so unfortunately, I think we'll probably have to do it again. But in terms of shoveling snow and everything, that's real stressful on your back, isn't it? Depending on if you're doing it the right way, if you're shoveling snow the right way, and different things like that.
Yeah, anytime you're bending at the waist, you're putting an increased load on that disc in your lower back. And the way they found this out is that they found some poor college students who probably need some beer money, but they actually stuck probes in their discs as they were doing different type of postures, bending or sitting or whatever, and they found that the number one thing is the worst thing on your back was sitting and bending forward while you're sitting and twisting in your chair. That puts more load on the spine than anything. Mm-hmm. And then obviously when you're standing and have a shovel full of snow of probably 50 pounds and you're bending forward, that's a good way to probably really mess up your lower back. So they have some interesting ergonomic shovels out there. That's what I have. That does help, but the more you can bend your knees and limit bending at your back, bending on your lower back, the better off you're going to be.
Or get a snowblower.
Or
get a snowblower.
or have a nice young neighbor kid that wants to make a few extra bucks.
There you go. We appreciate Dr. Swetlic joining us here. We're going to talk some more with him. Swetlic Chiropractic and Rehabilitation with us. They're on Upper Gilchrist Road, just down the road from us here. If you go high enough, you might be able to see him from right here at the radio station, but no, it's a running joke that I could get there without getting lost. So we appreciate Dr. Swetlic joining us. We're going to take this quick break. We'll come back, and more of AM Knox County is coming up. Welcome back. It is AM Knox County. It is a Tuesday. AM Knox County presented by Homes Rental and Sales. Here in 2022, we're going to get an opportunity to have Dr. Swetlic with Swetlic Chiropractic and Rehabilitation with us throughout the year. And we appreciate him spending some time with us. One thing that we've talked about, and some people don't really incorporate it as same as, core muscles and the importance on the back and different things like that. I like pizza just like any other person, but I know that eating healthy, and when I was on a keto diet and everything, I actually lost 23 pounds and then gained an inch on my height because it apparently straightened out my back too. Yeah. So it's important. That core area is important.
And you don't have to go to the gym for core. I mean, like at home, I have one of those big brown balls that you sit on, and you can just do multiple types of exercise. So I spend 15 minutes or 20 minutes or so in the morning doing a bunch of core stuff, and then I do a bunch of rowing and different things just to really always continuously try to keep my core and my back and everything tightened up and strengthened up so I can continue to work and function and do the things I like to do. But, when it comes a point in time in your life, like I just turned 61 or 2. But anyways,
that's 52.
Yeah, somewhere in that. But you got to start weeding out the 20% of things you shouldn't really do, so you can continue to do the 80% of the things that you still can do. So that's kind of where I'm at.
I've got a treadmill in the basement, and it's getting kind of lonely just because the kids are running around and stuff. I do try to throw around some weights to keep myself in shape a little bit, but there's core muscles. We've talked about the importance of those and just eating healthy. Like just mentioned the keto diet. I wouldn't recommend somebody stay on a keto diet their whole lives. Quite frankly, I think you'd probably die. But
just try to eliminate as much gluten and sugar and things of that nature you can, because those are all cause inflammation in your body, which gives you a lot of different aches and pains and some. Also, that's where most of the autoimmune diseases come from, is from just poor diets, and so that's critical. But and again, back to the core, though, that's probably one of the most important things you can work on, and probably one of the cheapest things you could do. I mean, you don't need a lot of big time equipment for that by no means. So
I used to just at home just say, hey, hold my legs down, and I'll do do some sit-ups there, and then go with it. So easy stuff there, but. Again, Dr. Swetlic with us, Swetlic Chiropractic and Rehabilitation. We thank him for joining us here. But we've talked about the back so much and the injuries to the back. And of course, that's important because obviously a lot of people come in with lower back problems. But you're seeing more of with the neck, too, because people are just on their phone all the time.
Yeah, and and a lot of younger, teenagers and kids as well, because, again, they're sitting on their phones a lot, and all you got to do is walk through a store, and they're all looking down, most of the time, and not just kids. I mean, all ages. Even myself now and then, I catch myself doing that, and I think, man, this is really, not good on me. But and so, but majority of most problems that arise from your back are postural things. We do the same thing every day. We stand and twist to the right, twist to the left, and bend over. We do that repetitively all day long. Or we're sitting at our computer with the screen too low, or looking down all the time. Now I do like your screens. They're at a great height.
We just set them today for you. No, I'm just kidding. But
that makes a huge difference. So I mean, it's just little things. Because Dr. Overhaul and I used to go out to a lot of businesses and just evaluate ergonomics and try to help them set up their office spaces better, and we used to go to a lot of the factories and different things here, and we really enjoyed that. So, so just little tips can make a huge difference. Just little stretching they can do every few hours or whatever at their workstation. So
we've talked about too, just getting up and maybe stretching your back for a few minutes instead. Every 15 minutes or something, just getting up and doing a little stretching, and then sit back down at the chair and stuff like that. Of course, I'm not following that rule because I've been sitting here for 23 minutes now. But
well, then what I really like too is a lot of the places are starting to get the stand-up desks too. So you can either stand up for a while and sit down. So that changing positions is critical. I mean, it's really your body just gets so stagnated just sitting in one spot all day that it's really tough on your spine.
Yeah. We're not talking about just older patients, 50, 60-year-olds. We're talking about kids, not like little kids and things like that. But you're talking about teenagers and stuff. They're having issues with whether it be their neck or their back and things like that. I mean, like I mentioned, I'm 30 and have had back problems.
Well,
so.
that's a kind of key. If we could educate them better at a very young age on good posture, and keep on them a little bit, which is easier said than done. I've had kids, and so they could learn the right way instead of learn a good habit instead of a bad habit. That's all I'm trying to say.
Yeah. Dr. Swetlic is with us, Swetlic Chiropractic and Rehabilitation, and we thank him for joining us here on the program to talk about what they do over at Swetlic Chiropractic and Rehabilitation, and just trying to keep people where they're in good shape and everything. Now, I want to talk about guys that maybe who, you played, you mentioned in college and in high school and different things, and is there a correlation between maybe guys that played or girls that played in high school and in college that they later in life will develop these issues with their joints and with their back and with those different things just because of the wear and tear they have on their body?
Yeah, I think so. I mean, anytime you're, playing any type of physical sport and putting a lot of trauma in your joints, yeah, it's going to catch up with you. But I'd rather see him going down that road. I'd rather see him being active.
Sure.
I don't care whether it's in the band or being in a play or whatever than just sitting and playing video games all the time. So, but yeah, of course. But I think that active people tend to keep themselves in a little better shape and tend to be on a little better diet. So they, they're going to have some problems. Probably less.
Yeah. I think about when I was in high school. Boy, that was a long time ago, Dr. Swetlic. I ran track my freshman year, and I remember running stairs and then doing wall sits and sit-ups and everything. I was in great shape, Dr. Swetlic. It was wonderful. But I know that, if one doesn't stay consistent with things and one says, well, I'm going to work out for a little while, or I'll have good posture for a couple of days. Doesn't work that way. You've got to be consistent with staying healthy and with your posture and different things like that, right?
Amen. I mean, it just has to be a lifestyle.
Yeah.
I'm an 80-20. I do really, really well 80% of the time, and kind of bad 20% of the time.
That's a C plus.
Yeah. So that's just kind of how I've been, and so, but kids, but I don't even know if they still even have gym classes.
Yeah, I think they do. But
I wasn't sure.
Yeah.
But I think kids need to be outside, getting dirty and muddy, and running around and playing ball or something. So. Yeah.
Well, we talk about when should one contact Swetlic Chiropractic and Rehabilitation. Is it the first time you reach down for something and you go, oh, there it is, that's my back, and they maybe sit back and go, I'll just kind of lay down and rest for a couple of days, and then it doesn't get fixed? I mean, when should one say, I'm going to make a call and make sure to get feeling better?
I think that, I typically, if you do something like that and you feel something, I would probably initially lay some ice on it, do some light stretching, give it 3 or 4 days, and it doesn't seem to be progressing, getting any better, then that's probably the time to call, So, unless the pain is so severe and stabbing and you can't move, well, probably should go to the urgent care first and see the good docs there, or the ER, and then visit us. But yeah, I wouldn't put it off for months and months and months. Because people are like, this has only bothered me since I was 20, and they're 65, and you X-ray them,
a couple of years,
and they're completely deteriorated. This might be a long time to get this better, but
So, let's say somebody does something like that. Is ice the way to go? Is heat the way to go? Are people saying, well, like when you roll your ankle or something, elevation, ice, all that good stuff. When it comes to maybe throwing out your back or something, they say
ice.
Yeah, so ice it up.
Yeah. 99% of the time, 95% of the time, you'll never get in trouble with ice. So, always go with that first.
Yeah.
But, if you really don't know, just call my office and we can tell you.
All right, excellent. We talk about the back and everything and the neck, but rotator cuffs, knee joints, and different things like that. You guys are able to help people with all those kinds of issues.
Yeah,
right?
we do a lot of stuff with knees, rotators, and even the jaw, TMJ. We get some patients even from the ENT doctor in town send us some TMJ patients. So that's your jaw, and So yeah, we deal any joint. I adjusted some thumbs this morning, a few wrists, ribs, ankles, knees, whatever. So.
Yeah.
A few noses over the years.
I have a propensity, or I used to at least, to roll my ankle all the time, and then I did actually have to go through therapy with it to strengthen my ankle because I would just roll it literally all the time. So certainly we tell people every time Dr. Swetlic's in here or Dr. Overhaul or Dr. Jenkins, don't live your life in pain because you don't have to.
No.
So
yeah. And, if you don't want to visit us, visit another chiropractor, go see your orthopedic, go see your family physician, or just get out and start exercising, walking and drinking some water and just a little core. Yeah. You can probably heal yourself up.
Yeah. I need to just start eating healthier. That's what I need to do. But I will start tomorrow. No.
Well, I'm sorry I brought this dozen Tim Hortons in this morning. It's Krispy Kremes,
Well, like I say, I'll start tomorrow now. But Dr. Swetlic Chiropractic and Rehabilitation, tell us again where you're located, your exact location there. So if somebody like myself doesn't know how to get places, I can put it in the GPS, and a little bit about your hours and things for people.
Yeah, if you just come to the top of the hill, instead of turning left into WMVO, you make it right, go past Maz's and down past Goodwill, and we're on the opposite corner there, right at the four-way stop. So you can't miss me. My name's on the front of the building, so anytime you want to just stop in, take a look, take a tour. I think the Chamber of Commerce is visiting our office on Thursday for an hour or so.
Okay.
So, which I think is really a cool idea that they get to go out and see different businesses. So,
yeah, very neat. So, Swetlic Chiropractic and Rehabilitation, we always appreciate Dr. Swetlic joining us, and just down the road from us here, and they'll be on monthly with us on the third Tuesday of the month, so we look forward to that. We do want to thank Holmes Rental and Sales, our AM Knox County sponsor. We're going to take this break and come back. More of AM Knox County is coming up.